Joining us now is Dr. Ronald Lederman. He is an orthopedic surgeon and sports medicine doctor. And Dr. Lederman, let me hit a button or two here. There we go. We got you up on Zoom. You're looking good, doctor.
How are you?
I'm great. So I always ask everybody, because everyone's been checking in from their homes, how's it going? Are you at home? Are you at work? Where are you? And I can see your scene there. How are you doing and how you feeling?
Yes to both. And actually, when this whole thing started and we saw the number of patients drop about 90%, we went to half days to stay open for the urgent orthopedic cases and people that were in so much pain that they needed our help, whether it be through injections or localized limited therapy and the likes. But we took extreme precautions when we did that. Of course, this was over a month ago. I think we were the first ones in our medical center, at the Lakes Medical Center in West Bloomfield. We actually set up a table out in the lobby of the building before anybody came into our actual office space, with taking temperatures and questionnaires and making sure everybody was properly protected. And so we have been seeing patients on a limited basis, but taking extreme precautions. And the other important thing is we're sterilizing the office with hospital grade material before and after every patient. So patients have felt very safe coming in, but we have also made sure that we get the message to everyone that stay home if you need to, if you can. And we also transitioned to telemedicine, which a lot of my colleagues, at least non-surgical colleagues, are doing.
Yeah, no, in fact, I was in your building not too long ago. There's a pediatrician in your building that we talked to. And you know, they're saying the same thing, that call, please pick up the phone and call before you come in for any medical care. Just don't show up at your physician's office. Call. And a lot of folks, we've been hearing over the past several weeks, there's a lot of telemedicine going on. However, if you've been treating somebody and, you know, their treatment cycle comes up, you know, they're going to be in severe pain and a lot of difficulty if they can't get that treatment. So you've been able to, it sounds like you've been able to continue that therapy for those patients.
Well, we have, but very limited. I mean, we might see 100 physical therapy patients in a day, and now, you know, it's probably 10 to 20 patients. And as painful as that may be, from a revenue standpoint, you know, you always talk about trying to generate enough revenue to keep the lights on, to keep the doors open so you can treat people that need you. What's good about that is 1 or 2 patients will have the entire physical therapy department. You're spread out. We're not 6 feet apart. We're 30, 40 feet apart. But yes, the short answer is we have maintained a lifeline to the community for people that need us. And if they have to come in, we are taking extreme precautions to make sure they're safe, to make sure our staff is safe, and that the community at large is safe. And if someone can't come in or doesn't want to come in, or we don't feel it's safe for them to come in, then all of our doctors, me, Dr. Portowitz, Dr. O'Keefe, Dr. Hyman, all of the providers, even our physical therapists are providing telemedicine. And my wife's best friend actually hurt her shoulder. She's been doing what everybody should be doing, and that's staying at home for the most part. And she actually did an online telemedicine evaluation with my director of physical therapy, Jenny Simmons, and she called me later that night and said it was amazing. So you think, how can a video conference or on the phone help someone with the physical therapy, which is very often hands-on, but it can. And it'll be interesting to see how this changes things moving forward.
Well, I never thought I'd be sitting in here doing a radio show with all of my guests on Zoom and then on TV as well. So now it's a new normal. It's a new world. Some good will come out of this with people working at home in a safe way and more telemedicine. I'm sure some of it, but I'm sure you'll also be happy and your patients will be happy when it's easy to come back into the office and get together as we have in the past. So, go ahead. I'm sorry.
Happy.
Yeah.
I'm sorry, but I was going to say, I agree with the quarantine, the lockdown. We obviously have to be very safe. One thing that didn't make a lot of sense to me is closing down the surgery centers to do not elective, but even urgent cases. I mean, if you step off your front porch and you break your ankle and it requires a 1-hour surgery to fix it and get the bones back in place, then you can go home. It always made sense to me, do it at a place that doesn't have COVID-19 patients being treated. But we've been forced to take patients to the hospital, and the hospitals that we work at, the Beaumont Botsfords, the Ascension Providence, the Huron Valley, everybody has taken very good precautions to keep people safe, thank goodness.
So, Dr. Lederman, I thank you for the update. So I'm curious because I read as many of the rulings as I could, and I didn't see all the details for physicians. So right now, if you do, let's say you break your leg, and you the only way you can get a treatment, and maybe you always would go to the hospital, I don't know, but the only way you can get any orthopedic treatment, we'll leave it general, is to go to a hospital for a broken bone of some kind? Is that what you're saying?
Well, it depends what kind of break it is. But no, I'm saying that's the only place, if you need surgery, that you can do it right now, because the governor has shut down all the surgery centers, the freestanding ambulatory surgery centers, which have become busier than ever before COVID-19, because there's been a shift. Even insurance companies are shifting surgeries, smaller surgeries, elective surgeries, from the hospital to a freestanding ambulatory surgery center, because you can deliver that care for a lower cost. You're not amongst sick people, so there's less of a risk of catching an infection while you're there having your treatment. And it just made sense that we should be able to continue to do that. But that hasn't been the case. And like you said, it's a new norm and everybody's adjusting, and that's fine. We're hoping we can get the surgery centers opened up next month, within the next 2 weeks. So all of those people that have had meniscus tears in their knees and have pain walking can get their 15-minute arthroscopic surgery done. For the people with rotator cuff tears that are, having tremendous pain and can't sleep at night, we can start fixing those. For the ankle, elbow, wrist carpal tunnel problems, we can start getting people better. But you're right, you mentioned earlier, right now people are staying home, and at some point they're going to want to come in and get seen. Even though they can come now, you want to take great precautions doing so. But when everybody's allowed to go to the doctor, it'll be interesting to see if the floodgates open and what that looks like.
Dr. Lederman, is part of the reason these surgical centers have been closed down because we need respirators and other equipment for the other centers, or were there other reasons why these other surgical centers were closed down?
That was definitely some of the initial reasons. But the anesthesia machinery and equipment we have is typically not what's used in the ICUs when someone's on a ventilator. So, what people do, and it's human nature, and especially with something as serious as COVID-19, is you take extreme precautions in the beginning, and I think they have, and obviously we're seeing the benefit of that with, everyone I've talked to. One of the best emergency room doctors I know, Dr. Sandy Veeder out of Beaumont Botsford. He's been the head of the ER there forever. We're hearing that things are really slowing down, thank goodness. Moving forward, that's going to be the trick. How do we open up? Everybody's heard about this on the news every day, all day long. And it's true. We need data. We need a way to test people accurately. I envision that people are going to have a card saying that they tested negative and use it the way they use their driver's license to get in the car and be able to drive. They're going to need it to get into the restaurants when they start opening up, or maybe even to go to the doctor's office. Now, doctor's offices have the ability to screen people better than most, but it's going to be very interesting. So the short answer, again, is we have not had to give, which we were more than willing to do, any of our equipment or even some of the lower level PPE that we use at a surgery center to the hospitals, because they did manage here to have enough. And
what do you advise folks doing? So if someone is listening or watching right now and they have some kind of pain, their knee, their elbow, their shoulder, something is hurting them, something you would see an orthopedic surgeon for, or a sports medicine doctor, you pick up the phone and call. Is that the first thing to do?
Yes. Well, for anybody that's in pain, we're there and we're able to see them. and we spread out all of our providers. So you can go to our website, which is LK Orthopedics, ORTHOPEDICS.com. You can actually make an online appointment, or you can call our office, 248-669-2000. And again, on the phone, there would be some screening, but if you're young, if you're healthy, if you haven't been exposed to anyone, if you come to the office, you will be screened. You'll have a temperature taken before you get into the office space, and you'll see the precautions we're taking. And even 85-year-olds who we have said stay home and wait, they've been in too much pain. They've come in and they've all said that the precautions you're taking have made me feel so safe, which really warms my heart, because this is a stressful time for everyone.
It is.
And if we do our part in bringing that down for people, then that's important, along with helping people with their pain.
So, Dr. Lederman, thank you for joining us. It sounds to me like your message for the governor for this afternoon at 3 o'clock and the days coming is, let's get some of these surgical centers open again as soon as possible so we can get back to treating folks. And you're saying that now we've got the vents out there in the community. You're saying that we can do this in a healthy way and get some of these surgical centers back open again, and that's what you're sharing with us today. Did I get that right?
Yeah, absolutely. And if we can have our governor and people in the White House, stop the partisan headbanging, I'm certain that she would be on track with that as well. But that would be the message. Let's be able to start helping people. Let's do it smart, and let's do it in a safe way.
All right, doctor. Well, hey, listen, everyone's advice is good. Everyone's opinion is good, and we're just going to have to count on that knuckle-to-knuckle thing you were talking about there a minute ago. Hopefully that won't be happening too much. But all we can do here in our show is just, let folks like you share your stories and share your expertise, and hopefully it will be heard and it'll make it better. Thank you so much for taking some time. Can we keep in touch? And let me know what's going on, because a lot of the issues I didn't really think about that you brought up today. I wasn't thinking about the surgical centers. For me, I want to go into some bar and have a pizza. That's what I'm thinking about. Not getting my sore knee taken care of. Well, I got to work on that. But so it's a whole other aspect of this thing I wasn't thinking about. So I really appreciate it.
Well, I appreciate you having me, and I'll be available to come on whenever you need any updates or help. Unfortunately, I've got more time than usual, but I think this is helpful, and I'd love to come back whenever you need.
Dr. Lederman, thank you very much for joining us. Dr. Ronald Lederman, orthopedic surgeon, right here on the MegaCast.